Hi everybody, my name is Patricia and I recently completed the AANP Adult Gerontology Primary Care Nurse Practitioner exam. I'm currently studying for ANCC as well because I do want to be dually certified. It's just a personal preference, but I'll tell you a little bit about that in a bit. But I've had several people ask me as adult gerontology primary care, what did I study and how did I prepare for the exam? All across Facebook, the internet, everywhere, you're going to find lots of stuff about the family nurse practitioner exam, not a whole lot about adult gerontology primary care. And so I wanted to do just a little video to share with you what my approach was, and also to tell you that I have created an adult gerontology primary care Facebook group, sort of a study Facebook group. And I'll put the link on here that you can find it if you'd like to join our little specific Facebook group. So anyway, just a broad overview, I graduated from the University of Texas at Arlington, May 2019. And so just graduated. I started studying for my exam probably 2 or 3 months before I actually tested. And so just kind of want to help you focus and get an idea of where to begin and what to look for when you're studying. So I started with this book, the Leak Adult Gerontology Nurse Practitioner book. This was my go-to Bible. But for understanding, this is to teach. This is not to study. And so before you prepare to take your exam, you have to know the content. There's no shortcuts, no easy way. You have to know the information. The Leak book is excellent for teaching you the content that you're going to know. When I ran into content concerns with Leak, stuff that I wasn't sure about and I needed clarification, then I went to the Fitzgerald book. And Fitzgerald does an amazing job with explanation. If you can get a hold of her videos or go to one of her live reviews or whatever, she gives a lot of very, very in-depth information that when the overview is not enough for you and you just need more detail, or if that's how your brain thinks, you're thinking, no, this is not covering it for me, go to Fitzgerald. She's great. Both of them have questions in their book. Leak has a lot of questions in her book. If you buy the book, the hard copy, you're also going to get the code for her app. That app is critical. The questions in the back of the book are the same as the app, but most people will do so many questions per night as they're ramping up to their exam. 25, 50, whatever questions per night to start studying. What I found was helpful was to go by system in the Leak book. You're going to do your system, then you can go to the app and go through those questions that match that system in the Leak book. So that's your sort of phase one. You're learning, you're studying, you're getting an understanding of what is going to be included in your exam. As you get closer, a month and a half out, if you have that time, do a live review. There are a few of them. Amelie Oye is one. Margaret Fitzgerald is one. Barkley is one. I have all of the CDs or audio for all of those reviews. Fitzgerald, Amelie Oye, and Barkley. I have all of the audios. They're similar, but their style is different. But the content is very, very similar. So if you can only do one, if Amelie Oye is the only one that's going to be in your area, do that one. It doesn't matter who you do. In my opinion, they're all very similar. Just do whatever is convenient for you and in a schedule that works for you. Again, 4 weeks to 6 weeks before your test date, try to do a live review. For me, it was imperative that I get on some of the Facebook groups. There are several of them, several really good connections that you can make on Facebook group. Latrina Walden was by far my favorite. Her Facebook page is very interactive. A lot of people kind of post questions that are good trial and training for you. Latrina also does what she calls a bronze package. There's 3 videos that she just kind of goes over content, points you in a good direction. A lot of her stuff is family oriented though. So take that with what it is. The pediatric portion, you don't need to know. Anything below Tanner stage 4 is pediatrics. Tanner stage 4 and above is adolescent, where if you are adult gerontology primary care, you want adolescent and above. So Latrina is great. Her Facebook page is wonderful. A couple of other great trainers out there. Rufi is one. You can do a Facebook search for her. She gives great information on her live review. I did hers as well. Joanne Asia does some amazing stuff. Find her on YouTube. She has, in my opinion, the best and funniest explanation for murmurs that you can find. Really, really good. And if you are doing ANCC, eventually like I am, you also want to look at her sort of standards of evidence and the stuff that she has available for ANCC. And again, that's Joanne Asia. And she does do, I think, one-on-one reviews. I haven't done a review with her yet. I'm considering it for my ANCC exam. But as of now, I have not done that. So again, you're going to start very broad. You're going to learn. Focus on learning. Leak and Fitzgerald, or your learning books. As you start broad and you're going to funnel down to, 6 weeks before your exam, you're going to do one of the live reviews. Oh Yay Barkley, one of them. Come down and you're going to do one of the small group live reviews. Latrina, Rufi, Joanne, myself. Anyone, I think I'm the only one that does the adult gerontology primary care review, and I do them one-on-one. So you're going to be funneling down, and now you find yourself a week or 2 weeks before your exam, you're in a panic, your heart's racing, you want to pass the first time. My motto was once and done, once and done. I didn't want to have to do this again. So that last 2 weeks before my exam, I put everything else away, and the only thing that I studied were 2 documents, and I'll put them below so that you can access them. I did a document called the Leak Exam Tips and the Amarina file, and I'll put those down there for you. Those were both created by nurse practitioner students who were preparing to test. Take it with a grain of salt, verify the information. I found no errors, but they're human too, so you might want to check your own stuff. The Amarina file, if you hear about the Haley document, that is a great tool as well. The Amarina file is the Haley document combined with the resources that I mentioned previously into one document. It's fabulous as far as I'm concerned. It's color-coded. It's by system. It's all the stuff that I like to study with, and it was just great. It was what I needed the week before my exam. The Leak Exam Tips takes everything. Whenever you are in the Leak book, she has little areas that are sort of highlighted out and boxed out, and it's exam tips. someone took all of those exam tips and put them in one document. 2 weeks before your exam, that's all you need to be looking at is those leak exam tips and the Amarina file. Now, understand me, you cannot shortcut. You cannot pass these exams by just studying the leak exam tips in the Amarina file. You have got to know the content because the questions are going to trip you up. You cannot just go through the kind of bullet points of the leak exam tips. Those are just sort of the point words that you need to remember, the system points to pass, but you have got to know the content. So read your leak exam book. This is the adult gerontology one, and she also has a family one. So whichever program you're in, if you're adult gerontology only, you don't need to read the family book because it's got all the pediatric stuff. You don't need to buy that book. Buy the book that's appropriate for your program. But if someone's passed it on to you and you have a family book, just make do. You don't need to go buy a new book. The reason you would buy a new book is because of that code that gives you access to her Leak app. And you can access that app on an iPad, iPhone, whatever. And again, it's invaluable. You can also read the book on the app. I found that a little hard because I want to tab things and I want to highlight and circle. I'm just a paper person. So for me, I needed that, the whole book, not just the app. But if you're sitting at a doctor's office or waiting to go in somewhere, whatever, you can read a section from the book on the Leak app, and it's wonderful. So I did, again, pass the AANP Adult Gerontology Primary Care Exam first try, and that was my study process. I recommend that also when you are starting, let's say you've been a cardiology nurse for all these years. Don't start with cardiology in the book. Do start with cardiology. Start with the information that you feel comfortable with. It'll build your self-confidence. It's going to be easy for you to understand, to grasp. And then as you get closer to your exam, you want the things that are harder to you. If you know nothing about musculoskeletal, you want that to be freshest in your mind. So start a couple of months out with the easiest processes or systems for you and work your way down to the hardest so that you build your confidence and it's fresher in your mind as you begin really studying that content. I'll be doing the ANCC exam in a couple of weeks because I want to. A lot of people ask, why do both? Some people don't recommend that you do both. I'm doing both, and this is why. I did my AANP, but a lot of places have a preference. I have a job. I will be going to work in a couple of weeks. They didn't care. But you never know what life's going to throw you next. And so one of the things that's on sort of my long-term goal is teaching to some degree. And the university that I went to, that I prefer to teach at, likes ANCC. I'm not saying I would be bored from being hard, but there has been some rumbling about, this job wants this certification, this one needs this one. So I'm not going to risk it. While all of this is in my mind, fresh, I'm going to do them both. I don't care what anybody else says. I'm doing them both. I'm going to have both of my certification. I got a really good deal on ANCC. Went ahead and registered for it. Going to take it, pass it first time, once and done. And then all I have to do from there is keep up with my certifications, and I'm fine with that. So you do whatever you're comfortable with. If you want to do one, that's fine. You do whatever you need to do. I'm going to do both because I don't want to risk in 4 or 5 years going into a scenario where they have a preference for ANCC and not being considered because I'm AANP or vice versa. And I just took AANP first because I felt like everything that I was studying was really more geared towards AANP. There wasn't a lot of non-clinical information. ANCC had just changed their exam for family nurse practitioners to include some different content, less non-clinical and more clinical. I wasn't sure if they were messing with the AGNP, and I wasn't going to risk it. So I just did AANP first. And now that it's about mid-year, I see that they haven't changed the exam for AGNP. So I'm going to go ahead and do ANCC, sorry, it's confusing, ANCC now, because you never know what the next start of the year is going to be, if they're going to change it or whatever. So anyway, I will put some links down at the bottom for you to a couple of documents. I don't own rights to those documents, certainly didn't write them, just studied them, and they're fabulous. I'll also try to link some of the Facebook groups that I was on, as well as my adult gerontology primary care AANP prep group. And I will, once I've done ANCC, that title is going to be changed to include both certifications. If you have any questions, just let me know. Happy to help in any way that I can. If you're preparing to test, best of luck to you. It's just, to me, it was just a common sense exam. And if you go through the process of starting broad learning down to studying the way that I recommended, I think that you're going to be fine. Good luck.